If you've been told by your doctor that you have prediabetes, they probably said something like this. Your A1C is a little high. Try to lose some weight, cut back on sugar, and we'll recheck it in 6 months. And then nothing. No urgency, no real plan, just watch and wait. In this video, I'm explaining the single biggest mistake people make with prediabetes and why the watch and wait approach is actually what allows prediabetes to progress into full type 2 diabetes. I'm Debbie Marini, former endocrinology nurse practitioner, and if you've been diagnosed with prediabetes and told to just monitor it, you need to hear this. Let's start with what prediabetes actually is. Prediabetes is typically diagnosed when your fasting glucose is between 100 and 125, or your A1C is between 5.7 and 6.4. These numbers sit in the gray zone between normal and diabetic, and because of that, prediabetes gets treated like it's not that serious. Your doctor might say, you're not diabetic yet, let's just keep an eye on it. But here's what that diagnosis actually means. You already have insulin resistance. Prediabetes isn't the beginning of the problem, it's evidence that your metabolism has been breaking down for years, possibly a decade or more. Your cells are already resistant to insulin. Your pancreas is already overproducing insulin to compensate. Inflammation is already elevated. Your gut integrity is already likely compromised. The only reason your A1C isn't in the diabetic range yet is because your pancreas is still able to produce enough insulin to keep your blood sugar somewhat controlled. But that compensation is exhausting your pancreas, and eventually it can't keep up. That's when prediabetes becomes type 2 diabetes. So here's the biggest mistake people make with prediabetes. They treat it like a warning instead of a diagnosis. They think, okay, I'm not diabetic yet. I still have time. I'll start taking this seriously when my A1C crosses 6.5%. But the prediabetes is the diagnosis. The metabolic dysfunction is already happening. The damage is already underway, and waiting until you're fully diabetic to take action means you've lost years of opportunity to reverse the process while it's still easier to fix. Think about it this way. If you had high blood pressure, your doctor wouldn't say, well, you're pre-hypertensive. Let's just wait till you have a stroke and then we'll treat it. No. You'd address it immediately because you understand that high blood pressure is damaging your cardiovascular system right now, not just in the future. Prediabetes is the same. Insulin resistance is already damaging your blood vessels, your nerves, your kidneys, your eyes, your brain. The complications that we associate with type 2 diabetes, neuropathy, retinopathy, cardiovascular disease, cognitive decline, they don't suddenly start the day your A1C hits 6.5. They're developing during the prediabetic years. And if you wait to take action, you're allowing that damage to continue unchecked. The second part of this mistake is believing that the solution is simple. Just lose some weight, cut back on sugar, you'll be fine. And yes, losing weight and reducing sugar can improve your numbers temporarily. But here's the problem. Those recommendations don't address why you developed insulin resistance in the first place. Prediabetes isn't caused by eating too much sugar or carrying extra weight. Those are symptoms of metabolic dysfunction, not the root cause. The root cause is chronic inflammation that's blocking insulin signaling. And that inflammation is often driven by gut dysfunction, a damaged gut lining, disrupted microbiome, and inflammatory signals coming from your digestive system. So when your doctor says just eat less and move more, they're giving you symptom management advice, not a root cause solution. You might lose some weight. Your A1C might drop a little. But the underlying insulin resistance is still there. The inflammation is still there. The gut dysfunction is still there. And eventually, usually within a few years, the numbers start creeping back up. That's why studies show that the majority of people with prediabetes progress to type 2 diabetes within 5 to 10 years, even when they're trying to follow conventional advice. It's not because they're not trying hard enough. It's because the advice doesn't address the actual problem. Here's what's actually happening in prediabetes and why it progresses if you don't intervene at the root cause level. You're stuck in what I call the metabolic inflammation loop. Here's how it works. Step 1, gut inflammation develops from years of processed foods, stress, medications, blood sugar swings, or other inflammatory triggers. This damages your gut lining and disrupts your microbiome. Step 2, the inflammatory particles leak through your damaged gut barrier into the bloodstream. Your immune system responds. chronic systemic inflammation develops. Step 3, that inflammation blocks insulin signaling. Your cells become resistant to insulin. Glucose can't get into your cells efficiently, so it stays in your bloodstream. That's insulin resistance. Step 4, your pancreas compensates by producing more and more insulin to force glucose into resistant cells. That's hyperinsulinemia, chronically elevated insulin. Step 5, high insulin drives fat storage, worsens inflammation, and damages the gut further, and the cycle reinforces itself. This is a loop that's already active in prediabetes, and if you only focus on lowering blood sugar through diet restriction or medication, you're managing a symptom while the loop continues running in the background. Your A1C might improve temporarily, but the inflammation is still there, the gut dysfunction is still there, and the insulin resistance is still there. And eventually your pancreas can't compensate anymore, and that's when prediabetes becomes type 2 diabetes. So what do you do instead? If you've been diagnosed with prediabetes, this is actually the best possible time to intervene because your metabolism is still compensating. Your pancreas is still functional, and reversal is still very achievable, but you have to address the root cause. That means breaking the metabolic inflammation loop. Number 1, heal the gut. Address gut lining integrity, restore microbiome diversity, reduce the inflammatory signals coming from your digestive system. This is foundational. 2, lower systemic inflammation through anti-inflammatory nutrition, stress management, sleep optimization, and strategic movement. When inflammation comes down, insulin signaling starts working again. 3, restore insulin sensitivity, not by forcing it with more medication, but by removing the inflammatory interference that's blocking it in the first place. When you do this, prediabetes doesn't have to progress. Your A1C comes down, not temporarily, but sustainably. Your fasting glucose normalizes, your insulin levels drop, and your body starts regulating blood sugar the way it was designed to. I've worked with countless clients who've reversed prediabetes completely. A1C's back to normal ranges, fasting glucose in the 80s, no longer at risk for progression by addressing the root cause instead of just managing symptoms. But it requires taking prediabetes seriously now, not waiting until it becomes type 2 diabetes. The biggest mistake people make with prediabetes is treating it like a warning instead of a diagnosis. It's not a maybe someday problem. It's a your metabolism is already breaking down problem. And the good news is that prediabetes is one of the most reversible metabolic conditions if you address it at the root cause level instead of just watching and waiting. If you'd like to understand the metabolic inflammation loop in depth and learn the exact 3-phase process I use to help people with prediabetes reverse insulin resistance and restore metabolic health, I put together a short free training that walks you through the entire framework. It's about 20 minutes and it explains why prediabetes progresses even when you're trying and what actually works to reverse it. You can watch it at the link below or in the description. Thanks for watching. And if this was helpful, please subscribe. I release new videos every week on reversing insulin resistance and restoring metabolic health. I'll see you in the next one.